and these are, two people that I'm referring to did go to a psychiatrist and were prescribed the medication, and it had um, very bad consequences. Don't you think, Yamir, that if someone thinks that they have absolutely no problems and they're so sorted and in control of that life, don't you think that's a problem in itself? Without responsibility and without accountability, there's no progress. Without discipline, there is no progress. Losing interest and feeling demotivated, feeling chronically fatigued, if you're having trouble sleeping, if you have headaches, if you have muscle tension in the body, if you have tightening or heavy sensation in the chest, anybody who brings up any of these, or let's say more than one, could explore therapy. And anxiety somehow, over the years has only become a negative word, but it's not always bad, or it's not always negative, because it also drives you to do your best.
Hey, welcome to episode 20 of Voices in My Head with me, Yameer Adhar. I know it's been a while, but I've had another child and we've had our hands full for several months, as you can imagine. Today I have Dr. Vimel Sahani. She's a counselling psychologist with several years of experience, and I've had the pleasure to get to know her over the last few years. I was keen to get Dr. Sahani on the podcast because, in my limited capacity, I've been fortunate enough to have dozens of people reach out to me for my advice or help regarding biohacking and mental health. And a lot of those people I have managed to refer to people like Dr. Sahni, who I know have created a huge difference, who've made an impact in a big way in those people's lives. I know this through personal feedback that I've received from them, as well as through several conversations that I've had with Dr. Sahni, and I've been educated in so many ways about mental health. I've been wanting to pick her brain for a very long time, and the opportunity has arrived today. The following is my conversation with Dr. Sahani. I hope you enjoy this episode and give us your feedback as usual. So happy that we could finally make this happen.
Yes.
Because it doesn't matter what I do to, or what I could have said to introduce you before this. But I think what matters the most is the number of people that I know that have benefited from counseling that you provide to them as a psychologist or as a counselor or as whatever it is that you do. And I wanted to get into that. And so I don't think any introduction would be good enough for the number of people that you have helped. And I know because I have sent dozens, I can say dozens of people, and I don't know any of them who haven't really benefited. So this is an extremely coveted podcast, and I know they'll be listening intently. And I know a lot of people will benefit from hearing what you have to say. Versus typically when you, I guess, in your field, you don't get to talk much, and the person you are counseling has to keep talking, or at least does most of the talking.
I actually don't think of it that way. That's your perspective, and I was looking forward to it because I love the way you keep it casual and very forthright and crisp. Because I think it's almost like we co-partner in wellness, because all the people that you have sent also speak very highly of you, and
sorry to interrupt, they don't know me, most of them, so I don't, that's why they probably speak highly of me. I'm sure my wife will have a different opinion, so you're yet to speak to her, but no, I'm just joking. But thank you for what you said. So I wanted to just begin by saying that how does it feel to live in someone else's head all the time? Because I just assume that, that's what something that a psychologist or someone who works in the mental health space like you do, and you do it all day, almost all day, every day. Maybe that's an exaggeration, but you do it several times a day for, I think, and you're working probably 6 days a week. So you're living in someone else's head, and that must be very difficult.
It is difficult if I consider it to be work, and if I consider it to be my profession. I consider it to be my calling. I consider it to be something that I have always wanted since I was 6 years old. And it's my passion. It's my drive. Like I said, it's my calling, and you're right, I do it pretty much all day long, and I wouldn't have it any other way. It's I think that human behavior and mind mapping are fascinating, and you do a lot of it yourself, so you know how the more you do it, the more you want to know, and the more it's mysterious and it's intriguing, and you want to know more and more about it.
Yeah, but my job is a lot easier from the point of view that firstly, I don't think I'm as on it all the time as you are, because also you've been doing this for so many years. I perhaps just started doing this a few years ago, and so it's weird to. I mean, I can barely just get about living in my own head, so I can't even imagine what it would be like for someone like you living in other people's heads all the time, or vice versa, maybe, because people live through their therapist heads a lot. But you said you like how at 6 years old what was that about that you decided that, or you
Human behavior used to fascinate me, and I would while all the other children in the room in my school and class would go around playing, and I would be very happy to sit, have my sandwich and have my lemonade and just watch people do different things and cry, laugh, have fun, intermingle, the way they would relate to each other. And I would go out and play sometimes because I was 6, but I would be very happy to sit and observe.
Wow. So at 6, and then, so I was going to ask you that stuff later a little bit, but since we're on this, so how did you develop it from 6 onwards? So you realize that you're fascinated by people and their behavior. So I assume you went through but you were abroad, right? You were not in India when you were 6?
Yeah, my father was working in Africa. So my childhood was, I was born in Delhi. I was 7 when he got a job abroad. So we went to Tanzania in East Africa. I grew up at Dar es Salaam, which is the capital of Tanzania. And I went to an international school. So that was my early childhood. And
wow.
The American system of education encourages children to just be. So the academics are fun, and observation is encouraged, and I made the most of that.
Wow, lucky you didn't have to cram any of the CBSE stuff that
yes
maybe most of the people listening had to. Maybe most of the people who like me who went through that system. And I was terrible at it because it's just that I don't think I have a very good memory, or at least I don't like memorizing things. It's easier for me to understand something and explain it, and that you get 0 marks for that in this system, at least.
Yes. Understanding and application, both.
And application.
Yeah.
So you were in so quickly then you were in Africa for entire your schooling life?
Yes, I completed my international baccalaureate because
you were in the IB system, right?
I was the IB system way before IB was introduced to India. So yes, I was IB, and after that my father got posted back to India. So ever since I've been in Delhi, which was way back in 89.
Okay. So and then, but you did your like psychology as a mainframe subject you picked up post your IB.
I had psychology as my higher level subject even in IB.
Okay, in IB. And you just, this is amazing that you knew this is what you wanted to do or at least you knew that this is what fascinates me. I mean, it's difficult for most people these days to, even perhaps in their 30s, that what is it really that we want to do, or what is it that we love, or what do we like doing?
Well, I wasn't really sure that I wanted to pursue this as a profession. Back then, it wasn't really known as a profession, apart from the fact that you go into the medical part of it or the clinical part of it and you work in a mental hospital. However, like I said, it used to fascinate me, and I would spend a lot of time observing. But when it came to picking up subjects for qualification, my first years of study in bachelor's and master's were art, like creative art, communication design. So I did that for many, many years. And it was, I think I was in my 30s that I had that, I constantly had that, voice in my head saying, find your platform, find your calling. Find your purpose, find your meaning. And that's when I did I started to study again, and I did my MSc in psychotherapy and counseling. And then later I went on to do my PhD in
and
psychology.
then it became official. You could live in other
Yes.
people's heads.
Yes.
And I'm amazed that you say that you can do this all day, every day, because however fascinating it can get, I know the toll it can take, because people are just coming with a lot of issues, even if they're small issues. And of course, the extreme end is somebody who's in a situation in which they think they don't want to continue living anymore. So it's difficult to just deal with that all day and not let it affect your own life. And I know you have the debrief method, and all psychologists have their own way of can you just explain what debrief is, because maybe for the podcast listeners?
Well, most of the practicing psychologists have a mentor or a facilitator, or they may call them a supervisor, whom they can go to, because as human beings, we all have pain bodies. We have our own set of painful experiences that we have had in the past. We may currently have, and we know that life is going to keep calling us with different situations, and we're going to respond. Some of them may be very challenging and painful. So we have our pain bodies. And sometimes when people come to us and talk about, sometimes when people have shared their pain with me, it's touched me, it's overwhelmed me. I may have said and done the right things while I was talking to them, but later on I would be hurting. And then, so that's when the debriefing or taking supervision comes in handy, because at that point of time, one can go and share that this is what is hurting me, and the mentor will help you to understand why and where and how is it touching my own pain body.
So I was under the impression that it's something kind of a check-in that you have to do. So is it not that you have to do it at a certain period, or it's just when you need it, you would reach out to your...
But we do have to. There is a protocol according to the code of ethics. We have to do it, but then this is something that may happen. Like, the have to could be once a week. The have to could be once a month. The have to could be once in two weeks. But if there is pain in between, and if there is the inability or the questions around something's happening to me and I don't understand it, the facilitator is available for us to go and talk.
And it's encouraged for you to talk to them.
Yes, encouraged, because otherwise we just carry that to the next session or the next person, or it may just have a residual effect on the moods for me, even if I'm not talking to someone.
Okay, that's interesting. And let's come back to, so why I wanted to ask you to describe in your own words what you do came from a friend of mine who came to do a session with you for the first time. And I don't think he had gone anywhere else before that, but so it was, he tells me that it was a unique experience, and this wasn't what he expected. I guess there is an expectation when you go to a psychologist or some sort of a mental health expert for help, or to reach out, especially for the first time. People don't know what to expect. And I would like to believe that every psychologist or every kind of counselor in this field has their own personality and style that they bring to it, and they're not just following a kind of manual, which technically, I guess, you're supposed to. So what is your kind of, what do you do? So like, I just wanted you to kind of explain that, which is, I mean, I know your profession is psychologist, counselor, and, I know all the degrees, but for a lay person.
I agree with you, Yameer, that, people have their own definition of what a psychologist is and what a when you go to a therapist, what would the experience be like. But as for me, I am a therapist and counselor. I have worked in clinical and non-clinical settings in the past 20 years of my practice. So I would put it down to grassroots level and say I observe body behavior, use of words, and I think about the ways of thinking, and I reflect that observation. That's all I do.
And okay, so that's perhaps going to fly over a lot of people's heads without any disrespect. So can we dumb it down a bit more for someone like me in terms of so what you essentially just said is that it literally you not change, but you model it according to the person sitting in front of you and what they maybe need in that moment. And so doesn't that mean that every single session of yours is perhaps totally different from the previous session that you had with the person in a way?
It's very different for different people. It could be different, it may not be different. It largely revolves around what the person needs, not necessarily what they may want. But of course, the want is paid attention to. And, so I think it's best explained through an example, maybe. But before I go on to sharing an example, I'd like to just expand on what I said earlier, like about my observation is, I'd like to say that each professional brings forth their own learnings and their own beliefs gathered around from their own life experiences along with the study we do to become a professional.
Right.
And the way we use the life experiences plus the study depends upon the personality that I am. And so I believe that if I have the ability to create a problem, then I also have the ability to solve the problem. So my approach in psychology is more humanistic psychology, and that is the platform of my facilitation. However, of course, I customize it to, like I said, whatever the need is. I believe each person has the ability and the potential to solve their own crises, challenges, and bring around the desired transformation that they may be seeking, sometimes subconsciously, and they also. So my job is also to facilitate them to learn, to tap into their very own internal resources. Because when I say that everyone has the ability to solve their problems, we are also born with certain resources we may not necessarily know about. And because of the social and the cultural model we grow up in, we are conditioned, we go more by conditioning and less by the simplicity of maybe something that we can resolve.
So I have 2-3 questions here. And so one is, of course, I want to play devil's advocate, because a lot of people, and I'm doing this more so that for people who have zero experience with going to a therapist, because I encourage everybody to go to them. Somewhere when you have a cold or you have a fever or, you've got COVID, you go to a doctor and the doctor says, okay, your fever, you have this paracetamol for the fever, here's something for the headache, here's put this on the, you fractured your arm, here's a cast and it's going to heal on its own. Versus it sounds to me when I'm coming to someone like you, you're going to make me do all the work. So why am I coming to you if you want me to do all the work is a question that maybe a lot of people may ask or may have and say that, what am I paying you for? Aap to sara kaam mere se kara rahe ho. And I don't know, maybe you get that sometimes that, I've come to you for help, you answer my question, and people want, or people expect their therapist to, should I divorce my wife, for example? So, yeah. But the truth is that, or at least what I understand from you is that you are not going to tell me whether I should divorce my wife or not, but you are going to help me get the answer myself. whether I should take this action. And that sounds like a lot of work. And that's maybe something that's really dissuade someone, or that may throw somebody off when they come and think that, I was expecting a magic bullet here, but it looks like I have to do all the work.
Yes, except that I don't see this any differently from, let's say, a visit to the doctor. I like that example that you shared. If somebody has a cold or fever, they go to a doctor, the doctor prescribes a set of medications or some tests, but the tests are done when the patient cooperates. The medicines take effect because the patient agrees to take them in their own homes, at their own times, at the prescribed times and the prescribed dosage. It's pretty much the same with me. See, three things go into wellness. One is the medication if required, one is therapy, and the third is one's own participation and one's own wellness. So even if we are looking at the physical level, I have fever, it's my fever, my discomfort. I choose to go to the doctor. The doctor may prescribe medication, give me an injection, write some tests. That's something that I will figure only when I go. But the rest of it, I still need to do.
Yeah, but it's a lot easier to swallow a pill, right? And I'm totally anti that. I mean, from
Yes.
several other interactions that we've had, that I'm anti pills and I'm anti maybe the easy way out, because I know there's no such thing. I know there are no shortcuts and there's no easy way out. But I was trying to address an expectation that someone may have. And why I feel it's also not anybody's fault is because when you're a child, you have fever, oh, your mother's given you paracetamol, crocin, whatever, you move on. So it's an easy fix that you get used to, rather than, or very few households maybe of the sort, and say, okay, no, I know you're suffering right now, but if we can perhaps avoid this, because you don't need it at the moment. A fever is actually a good sign, because that means your body is raising its temperature to fight off an infection or a virus or whatever is in there. So it's increasing the temperature. So if you can tolerate it for a little bit longer, you will heal. Actually, you will heal faster by not suppressing the fever. Obviously, I'm not a doctor, and don't do anything stupid. If you have 104 fever, of course it's dangerous, and for infants it's dangerous, and for certain type of people, any sort of fever is dangerous. So I'm generalizing by saying that the response is fever, eat a pill, get the fever down, and you move on, versus maybe doing a little bit more work, or maybe understanding a little bit further that actually your immune system is helping you by increasing your body temperature. So it's gone on a little bit of a different rant.
No, I agree with you, and that's a very fair argument, because I do think that a lot of people have that as a question, that why I already have so much going on in my life. There is so much of confusion. There's so much of chaos. And if I go to a therapist, why should I even invite more homework to do? But see, we know in life that without responsibility and without accountability, there's no progress. Without discipline, there is no progress. And you're one of the people who, you are like epitome of discipline, right? So you know how effective that is.
I'm not sure if I'm the epitome, but I like a routine, and I have to be disciplined for my mental and physical health. I don't have an option in my mind.
Absolutely. Each one of us needs to be. Some people recognize it, some people don't, but then I think eventually we all get there. And I think there is a cultural angle to it as well, because human beings have 4 dimensions: physical, mental, emotional, and spiritual. The physical aspect, if I have fever, I need to take the pill, is something that is conditioned. We believe in it. We don't have a problem doing it. But if I'm feeling hurt, if I'm feeling disappointment, if I'm feeling angry, sad, grieved, I expect somebody else to make me feel better. If I'm having bad thoughts about someone, or destructive thoughts about someone, I expect the other person to change their behavior to make me feel better, or change my thoughts. That is what we need to change there, because for all 4 dimensions, eventually we need to learn to take responsibility, just like we take the pill. We need, and the mental and emotional level is no different. I think most of the times it's like people don't know how. And once they know that it's not as hard or as difficult as they they assume it to be, then they do it.
So I think the expectation should be clear if someone is coming to a therapist or a counselor, and I think that's extremely empowering. So rather than going there to create one more kind of person who is responsible for you, it's good to know that at least I guess most therapists, the idea is for you to make that person, empower them enough that they can take care of themselves. And I don't know if everybody works like that, and I don't know if it's a wise business decision or a professional decision, because the longer you have a client, the more money. And I mean, this is just
Yes,
it's
it
the
is.
basics of.
It's a fact. It's a fact, and you're right. Maybe not everybody works like that, and but I personally believe that there are no fix-its with anybody else except yourself. You want to fix yourself, you need to take responsibility to do it. And yes, it may not be a wise business decision, but my conscience remains clean with that. Let's put it that way.
And this is also perhaps why you can do this all day, every day, because you are empowering or trying to empower the person coming to you versus control them or give them all the answers, which the person should be able to find themselves.
Yes. I was just going to add that supposing they come with that expectation that, someone else can fix them or someone else can make them feel better, and I actually end up doing it, I feel I'm enabling them.
Right.
I wouldn't be, and that is not my definition of help, because it is not an empowering way to be. It's, if I want to be satisfied, I want to be fulfilled, I want to remain unaffected, I want to remain happy. I need to know how to get that for myself.
And you will provide tools for the person to be able to do that.
Correct.
So still part of the same question is originally what I also wanted to ask you was, there is a, there is that diagnostics famous manual, American Psychology Association manual, which, a lot of people that I follow hate, in terms of a lot of people in your field of work that I follow really criticize it for various limitations that it has. So I assume in India, there is something similar that you're supposed to, is there something like that in India that you're supposed to work within the framework of?
We have the diagnostic statistical manual. It is called the DSM. And
yeah, DSM, is there like an India DSM also? Or there's a DSM, like a global DSM, which everybody has to consult?
Even I'm not sure whether India has a separate one, but even if they have one, there is an overall one from which the information is taken, because it's updated.
Right.
Yeah.
Yes.
It's not the first one that came out and the one that is currently running are very different, because there's a lot of research in this area, which is ongoing, because it's a relatively new field.
But it's kind of accepted, recognized, respected in India to work within that framework.
Yes, but it's more for clinical setting, not so much for psychologists. I mean, it's a point of reference for psychologists.
Can you just differentiate what is a clinic? Because you mentioned earlier also that you work in the clinical setting and outside. So what is the real difference?
Yeah, so a psychologist works outside, can work in a hospital, but doesn't necessarily have to work in a hospital, whereas a psychiatrist works in a hospital, right? Because they are trained to study the anatomy, the physiology of the brain, and prescribe medication for that. And thereby it makes it clinical. Like, for example, clinical psychologists are trained to run assessments and are more diagnostic in their approach. And that is why it's called clinical psychology. Whereas a psychologist, there are various types of therapies that psychologists follow. I'll get into it in a little while. just to kind of inform people, because it's interesting to know about it. And so psychology, so psychoanalysis was developed by Freud and was based on the idea that symptoms of psychological distress were caused by conflicts between unconscious forces within a person. And from there evolved the psychodynamic therapies.
Right.
Because the psychoanalysis became controversial over the, after Freud came up with the idea, and there were other people who joined the discussion, and some people emphasized the power of the unconscious was more than the conscious, and then it kind of captured the imagination of those in the new discipline of psychotherapy, and that is how psychotherapy evolved. The humanistic psychology was pioneered by Abraham Maslow, as I think we all study the structural
pyramid
needs, right? And he mapped out a new psychology, believing that humans are self-actualizing beings, striving towards achieving their unique potential. And later in the 1950s, Carl Rogers was the first to use the term counseling to describe a new humanistic psychology way of working with people. And he and his colleagues developed the person-centered therapy approach. Carl Rogers himself was a practicing clinical psychologist who came up with his humanistic approach and then developed these ideas into a new form of therapy. So, and because he was, his famous book was called Client-Centered Therapy, I think, which came out in 1951, if I'm not wrong. He talked about how for him the terms counseling and psychotherapy were used interchangeably. And that is where therapy and counseling kind of became interchangeable. And he kind of minimized the monstrosity around the term therapy for mind.
Right.
Have I digressed? What was the question?
No, that's fine. I think this is fascinating, and I would love to discuss Freud. I'll just come to that in a minute. What I was asking you, or what I wanted to also ask you, was that coming back to individual styles, and I think this is so important, and this is why I've always said you should, if you're starting out therapy, try out several. If you can afford, try it at least 2-3. Don't just go with the first therapist you kind of do your first session with. Try 2-3 out, because and go with one which you feel you're most aligned with, or the person is most aligned with you and your values and your thoughts. Because that's the only way they can help you. If you don't have that faith in the person, it's never going to work. So how much are you allowed to, is it just a guideline, and how much are you allowed to not go by the book, or how much are you supposed to go by the book, and how much leeway do you have to really develop your own style in helping someone?
Leeway is 100%. How much do we go by the book is that, of course, it's a reference. To qualify psychology, we need to use it a lot. So DSM came about through feedback, observation of symptoms on different people. And I think the data started to accumulate post the World War II, where the first form of any kind of psychological distress they noticed was the PTSD, which is the post-traumatic stress disorder.
Right.
Because people came home from war, and people who were waiting for them were affected, and the people who came back were all obviously affected. And and then later over the years, as psychology developed, the first DSM came out, and it is a cluster of symptoms that they use to describe a disorder.
So it's to diagnose, basically.
It is to diagnose, but it is not it's not a therapeutic manual. So
there's no treatment involved in that. There's no treatment suggestion.
It is not an absolute. It is a reference. So for example, if there are, let's say, 15 symptoms listed for bipolar disorder, somebody
Right.
coming to you may not have all the 15, because there are different intensities to a lot of the things that are associated to the mind. For example, when for like, let's make it very simple. Let's say somebody says, मेरे को बहुत गुस्सा आता है, which is a common thing that we hear, right? And it may start with small bouts of irritation. It may build up to frustration. It may build up to chronic irritation, isolation, bad mood, bad behavior. And then maybe we have a term which may qualify that to be anger.
Intermittent explosive disorder.
Yes. And then
I find that it's a really stupid term in my opinion. But anyway, sorry to interrupt you.
Yes, so it qualifies as anger, and then the anger could also graduate to rage. The rage could graduate to violence and aggression. And after that is the explosive, by the way.
Oh, so that is when you term it as intermittent explosive disorder.
Yes, yes.
But tell me, don't all of us have intermittent explosive disorder then? Because sabko gussa, I mean, you get angry, right? Like it's impossible not to.
I don't think I don't. I have a problem labeling everything as disorder, because then it's like
exactly
affirming it that it's a problem.
That's what I'm saying, because then we all have some. Yeah. Obviously, we all have some disorder. Yeah. We do.
I would like to look at it more like it's a maladaptive way of handling the anger.
Right.
Yeah. And so why let it store to the point when it explodes? Why not nib it in the bud? Like when the irritation builds up, or when one is feeling frustrated, or loss of interest, demotivation, any of those would be indicative of building up of anger.
But it's not necessary, right? That I early on in the podcast, I got Parul, who had introduced us.
Yes.
And I had asked her some similar questions, and she'd also said, lack of, if you eat too much or don't eat, lack of appetite, or sleep too much or don't sleep. But it's possible. So this is going by the book, but it's possible to have any of these disorders, including depression, anxiety, and not perhaps display any of the typical symptoms which are listed in this book, or listed because there are 8 billion people in the world. There has to be some people who are extremely depressed and suicidal, but they perhaps don't have most of the symptoms that you typically expect a person. It is possible, right? In theory, it's definitely possible. And I'm sure you've had maybe cases like this.
Absolutely possible in theory and in experience, both. And for example, if you I've often found that people who have rage issues, or who say that they have anger issues, if they become aware of what are the thoughts, or what are the triggers for them, and what is the type of anger. There are 7 types of anger. What is the anger that they're going through? What are the types of anger they experience, and how it begins to build up? They're often able to then curb it, or like actually cure it.
7 types of anger.
Mm-hmm.
Wow. And then I guess there are several types of everything else too.
Yeah, there are several types of depression. There's
bipolar disorder,
anxiety. Yeah. And that is because there are different types, and the moderations are also important to figure out. That is why most of us remain functional.
Right. And when you say, so who would be the ones who are not functional? These are the people who are, what are they doing differently from the or dysfunctional?
They're doing certain things right that work to keep the functional aspect of themselves going, and there are others who have let themselves be. They don't ask a question. Like supposing they're not feeling like doing something, they just don't do something. And then they do it today, and they do it tomorrow, and they do it day after, and it goes on. And then there is a state of chronicness. and the chronicness then becomes a disorder. It takes a long time to get into the space of it being called a disorder. Sometimes it's also learned behavior. So the incapacitation for action can be learned depending on what's gone on in the family dynamics, or it could be because the person procrastinated to do something about it when they first noticed the symptoms, and stayed with it over and over and over again. So see, either you become proactive and deal with the low feeling, or the disinterest, or the antisocial kind of feeling that you're developing, or if you feel like remaining isolated, either you do something about it, or otherwise the symptoms just then become bigger and they start to overwhelm, and they kind of take more space in your head.
So this would be a good time to discuss of how, and I don't think there is an easy answer to this, of how does one diagnose if someone needs help now, whether it's yourself or whether it's somebody in your family or your friend. Because I started therapy only a couple of years ago, but I had started working on myself maybe 4 or 5 years ago. But before that, I needed help for so many years, which I didn't get. No partner, companion, girlfriend ever saw it, ever recommended it, despite me perhaps being the worst to them. Somebody I was dating for 6.5 years before I met Shanamli, and not once in that very unhappy relationship, and I'm fully ready to take responsibility here because of my mental health issues. No fault to the partner or the person at all. Not once did she, or maybe her parents, or maybe any of my friends, or maybe even anybody in my family, not once did someone say that this seems to be an issue, you need help, or go get help. And not just because of perhaps the stigma and the taboo surrounding mental health, and it's becoming much better now because we can talk like this about it, and there's so many people talking about it. But nobody once told me that I think you need help, just get some help. And I knew it. I did know it, but maybe I didn't do enough, and I wish I'd got that help earlier. But what I'm trying to understand is, how do we tell somebody who's listening that to maybe recognize that, do something before it's too late for themselves or for their family member or for someone they know? How do you, as a layperson, diagnose this? And it doesn't help to know in the current context ki bhook pyas nahi lag rahi, or not hungry, not sleeping and all. That's these days, who's noticing if you're too hungry, and who's going to notice it to that micro level?
Yeah.
Even people are so busy, and in this COVID world, everybody's brain is, I don't know what people are focusing on, but I'm not sure how many people would notice if I was eating less or I suddenly started eating too much. I don't know.
Yeah, well, yeah, you're right. It is very hard for someone else to detect unless there are some behavioral changes that they notice. Like if you were more joyful earlier and you remain sad, but not necessarily do people bring it up even if they do notice. I find that more open today than maybe at the times when I was growing up, and maybe at the time you were growing up, it wasn't as okay for other people to say, go take help. And so I don't know what their reasons were, but today
now,
certainly there is more openness to it. Because a lot of the people who come to me are through recommendations. So someone says, they talk, so clearly someone's talking about it and listening to the other person and then saying, listen, go take help.
No, so that's definitely happening, and I know it because most of the people that I have referred to you, I actually don't know them. I've never met them. They have come to me or messaged me through Instagram or social media or some other medium, and they've said this, and now I am educated enough to tell them that, if there's asking about basic biohacking and stuff, maybe something related to my book,
Yes.
I can help them. And there are a lot of people who did that masterclass with me too. And I realized on the second or third masterclass with certain people that this is getting into an area that I am not qualified to handle. So I have to, it is my duty to hand them over to a professional like yourself who can, or who has the experience to help them with that aspect.
Yeah.
It's because I understand that that's happening, but the only reason I referred them to you was because they reached out to me. I am talking about a scenario in which how does a lay person recognize that, looks like there's some sort of something going on here and they can use some help. And also it's not easy to, even your best friend, how do you really tell them that, I think you should, somebody may take it very badly that you should go see a therapist.
Yeah.
It'll help. Even though I shout from the rooftops and I tell everyone that even if you think you're feeling fine, just the way you go to your physiotherapist before you get the injury. Don't wait to twist your ankle, or if you're an active person, keep going to the physiotherapist to keep getting attuned so you won't get injured.
Yeah.
Similarly, that's my advice to people for mental health. But that still doesn't help to know that someone needs help and send them.
No. Well, one way of looking at, one way of doing it is just to, if the other person just doesn't seem maybe joyful enough, or they talk about issues, then one can say that, you need to take help. Maybe it's not just about the situation, but it could also be about the way you're interpreting whatever you are experiencing, whether it's in a professional front, whether it's in the personal relational space, whether it's the dynamics of the family, or just in oneself, like within oneself. So that's one way of, kind of figuring out whether the person may want to go. Whether they go or not, ultimately is their own call. The other is the physical symptoms begin to show up. For example, if someone talks about difficulty in concentrating, losing interest and feeling demotivation, I think these are the two things that are very commonly talked about. And that is the window into taking help, because it is as early as that, losing interest and feeling demotivated, feeling chronically fatigued. If you're having trouble sleeping, if you have headaches, if you have muscle tension in the body, if you have tightening or heavy sensation in the chest, anybody who brings up any of these, or let's say more than one, could explore therapy, because it's mind over body. It's not the other way around. There could be unsustained and growing worries. There could be restlessness. It could be also obsessing over small things, like, sometimes when people say, this person said this to me and I can't get it out of my head. And the question to ask that person may be that, has it always been like this with you? And if not, then that could be a window. Those worries can apply to any aspect of life, from social situations to family dynamics to physical health and to professional concerns, like I said. So, and one does not need to, like you said, one does not need to wait for it to become worse to seek help. The longer you wait, actually, the more difficult it becomes for the person who's experiencing it, and also for the intervention to happen.
So do you see merit in someone who feels that they're absolutely fine, they need no help at all, to also just once in a while do some sort of a check-in with some sort of mental health professional? Is there any merit, or is there absolutely no merit in doing that?
Don't you think, Yameer, that if someone thinks that they have absolutely no problems and they're so sorted and in control of that life, don't you think that's a problem in itself?
No, I mean, that's a good one, but there are people I know like that, right? Okay, so Riju Jhunjhunwala came on my podcast.
Yeah.
I don't know if you saw that episode, And I would think after what he's been through, he's had a life-changing event, kind of. He had a near-death experience.
Yes.
I mean, I would think that somebody like that needs help, but and I'm very happy for him. But at least he claims, and of course, I'm friendly enough with Riju to say all this as a joke, and even say it on the podcast, that at least he claims that he's fine and he's doing better than ever. So I mean, I'm just using Riju as an example. Also, he's a hot selling topic. So if I mention his name, so views will go up and more people will listen to the podcast. But I understand that you're saying that if somebody says they have no issues at all, so let's assume that there are people like that, and maybe that is the issue, that they have no issue. And I know a lot of people in the current scenario, a lot of times that I'm talking about mental health things to people, and it comes up that this person has suddenly got this issue, and my response is, this is the issue of not having any other issue, or not being busy enough, or that's what I kind of mean. When you don't have any other issue, you start looking for issues. That's human tendency.
So long as we are on planet Earth, so long as we are students of life, there are always issues. They may be hidden issues, they may be tucked away issues, they may be overlooked issues, there may be denial issues, but it's an issue. So a good way to do it is maybe, or let's say maybe not good, but the appropriate way to approach it is to kind of just say that here's the name and number. Whenever you feel ready, call this person.
Or at least think about it.
Think about it. Because you never know when change happens, or when something comes along which one feels inadequate to handle. That's the time to take help.
And you mentioned that this whole mental health and psychotherapy and counseling and all developed from, let's say, World War II, when post-traumatic stress became evident in soldiers and families. And now with COVID, so 2020, this has to be the World War III equivalent event. Or, I mean, I don't want to be insensitive to compare it to any tragedy in the past, like the World War and millions of people dying. But I think this is no less, because this is another. I'm looking for a global event on that scale, and I think after World War II, it has to be this event. Maybe the plagues and the Spanish flu and stuff in the past, but I don't think civilization as we know it was affected the way it has been because of COVID. Also because in the 21st century, the way everything is connected, and with the fluidity of movement of people across continents, that is why also this has to be like that kind of an event. So in the COVID perspective, this is the biggest crisis of mental health in my opinion. And I keep telling people that in 5 years, we're not going to remember COVID, but mental health is going to be a pandemic that you will have. I mean, COVID is going to look like a joke when we look back with what the mental health crisis of the world is going to be. And I guess it's already building towards that, or maybe it already is. So I just wanted to get your thoughts on.
So since I had mentioned the World War II, I'll take it up from there and come towards COVID. Back then, life was more simplistic, and the expectations people had from life were also different. Today, the expectations are different. And after the World War II, when the Holocaust happened, people were taken to the concentration camps. And, I think that's one of the worst of the human experiences written down in history. Of course, a lot of trauma came out of that and the World War II. But there was good that came out of it as well. Viktor Frankl, a survivor, came up with logotherapy. There are a lot of psychologists who are survivors of the Holocaust and, of the Auschwitz. And they talk about their experiences, and I think they figured out how to convert their pain into power. And that is what they share with the world today. And God knows how many millions of people's lives they have been able to transform because of their own pain and their own ability to survive that experience. Um, I think for COVID, so when I say people's expectations were different, I feel that back then um, there was more of a need for survival. There was more of a battle for survival because the basics of life were missing. Today, we are in a world where technology, facilities are a norm for us. Back then, it wasn't. And it didn't even exist. Mm-hmm. So COVID, I feel, has had positive and negative impacts, just like any other calamity in history. I think that a lot of the people who approached the difficulties that they have gone through, it could be losing family members or loved ones, it could be losing a job, it could be financial crisis, having gone through COVID themselves. So the medical battle and physically fighting the disease in itself, the approach has helped to determine the outcome. So if they looked at the situation with despair, it's made it worse. If they looked at it with a bit of hope, I think it's worked positively. So the responsibility to come out of any situation, we choose. We can come out of it bitter or we can come out of it better. Of course, it's painful. And this is not to minimize the amount of pain or the intensity of the loss or the magnitude of the losses that have happened during this time. But one thing that COVID has taught mankind is that nothing is for granted and anything can be taken away from us at any point of time. And the loss of planning, the loss of boundaries, because people have been cooped up at homes and not everybody has a lot of space at home. So the lack of physical space, the work, the families, the family members all together, it could bring out compassion and coordination, but it could also bring out a lot of hostility because of the lack of space. One of the things that has been detrimental during the COVID times is the level of anxiety has gone up, the suicide rate, the suicides have gone up, the addictions have gone up. There has been a divorce boom and there has been a baby boom. So it's both ways. The positive effects are the value for family, I think, has gone up tremendously. The home, I see more people shopping for homes and looking after their homes, redoing their homes, making, thinking, being mindful of the home they live in. And maybe something that they didn't do earlier. And the overall health and the importance of having hobbies. I think these are the positives. Of course, the negatives have left their own impact, and it may take several years for some people's lives for them to feel normal again, especially people who have lost many members of the family or have gone through a lot of financial loss in let's say the treatment that was imparted in hospitals, or when Delhi was on fire for the second time, for example, I know of somebody who paid 25,000 rupees for an ambulance ride, which was not more than 20 kilometers.
Yeah, I'm not surprised by that at all. I mean, there was all kinds of crazy stuff happening that time.
Yeah. And that was if they went from spot A to spot B, and the spot B, of course, had no beds, then it would cost more to go to spot C. Different experiences, different impacts. I think it's personal. It's different for the way people have experienced it, and it's the impact comes from the way they have interpreted their experience. largely to answer your question, I think it's had both positive and negative impact.
How do we really, are we ever going to be able to move on from this? And I know human beings, we have short memories, and that's the way we've survived for 5,000 years. And I understand that narrative. But at the moment, even for someone like me, it just feels that, when is this, when is this going to get over? When are we going to get through this? When is this getting over? Because it's becoming very difficult to remain patient. And this, it's been more than a year now. And I think, that it's perhaps worse than being in jail, because when you're in jail, or anybody who's in jail knows they're either in there for life, or they're in there for 5 years, or there is some sort of finality to that. Or I'm in jail till I die, okay, or I'm in jail for 5 years, or I'm jail. I mean, and this is worse than jail in a lot of ways. I mean, I'm not trying to compare it to, I wouldn't know, but my guess is that there is some structure to being in jail. This seems to be an entity that has no structure, that can, you're at its mercy, and you don't know. The unpredictability of it is what is really causing the anxiety and the stress and the mental health issues.
I think uncertainty is a part of any crisis that we face, whether it's of a smaller magnitude or a bigger magnitude or a huge magnitude like COVID. And I think the reason it's a part of the experience itself is because the lesson lies in learning to cope and embrace with the uncertainty. Because I think as human beings, we love to plan the next vacation. We love to plan the next birthday. We love to plan the next anniversary. We like to plan today, tomorrow, day after, right? We like to plan what we're going to wear tomorrow. Who are we meeting tomorrow? What are we going to be eating tomorrow? Well, I think uncertainty is an experience which is very hard to handle. But because it's hard to handle, it also has the lesson of, I would say, learning to let go, for human beings to lose control. Because I think before COVID came into play, maybe human beings were over-exercising control.
And taking everything for granted, of course.
Yes. Including relationships, including...
Well, I mean, I tell Shamli any like the brief occasions that we managed to get out and have a meal in a restaurant or something, that, just imagine, will you ever take granted? Will you ever take going out for having lunch or dinner outside for granted? Never. Like, or even, I don't know. I mean, it was you just never thought about these things.
Yes, exactly. Because we believe it's there. So I think that's the number one lesson, that we can't take anything for granted. And I think if we can't take anything for granted, don't you think we learn to value it more? We learn to pay attention to it more. We just the fact that we value it more, I think our relationship to that person, to the home, to money, everything changes around value.
Yeah, but we've kind of we've been forced to do it, right? Rather than, of course, it's great to appreciate and see the change in a lot of people, or the change from maybe the rat race or just working, and saying that, okay, there are more important things in life than just doing one particular kind of thing. But it's like somebody's put a gun to our head to do that. So you also have that in your subconscious.
I think that we need to learn by force, because we don't learn by choice. If we learn by choice, then we don't need to be forced to learn.
I mean, you mean that's why we need exams?
Yes, that is why we need exams. That's why we need life exams.
Oh, life is definitely an exam. So I have no doubt about that.
And if you look back in your 10 years of life, like, let's not go too far back, but if you look back at 10 years of your life, do you not feel that today you are better in every way than you were 10 years ago?
In a lot of ways, for sure. I mean, I'm definitely maybe a happier, more evolved person, and that's I guess again that's subjective, but at least in my own eyes, I'm in a better place now than I was 10 years ago. Well, much better place now than I was 10 years ago. 10 years ago, I perhaps thought about killing myself.
Yeah.
So definitely, there's a huge improvement
Yes.
from that. And I wanted to really talk about anxiety with you, because that is something that is now, I don't know anyone who's not anxious. Of course, I have my own anxiety issues, but everyone is anxious, literally. And this is, I know that it has to be related, it is related to COVID too. And this is, children are anxious, their parents are anxious, grandparents, I mean, all age groups, there is this huge explosion of anxiety that everyone has. And I know that there are different limits and different quantums of anxiety that people have. Some have debilitating anxiety and some have a very normal, manageable, or less intensity anxiety, but anxiety nevertheless. So what do we do about this, and how do we deal with this? And
yeah, and I agree with you. It's brought up a lot of anxiety issues because COVID has brought up the three basic human fears: the fear of death, the fear of people, fear from people, and fear for people. So we fear from people, like, this person may have COVID, and that has drove us into loneliness and isolation. And fear for people is like for the people who we love and people we care for. And the fear of mutilation and uncertainty, because if I have COVID, I don't know what's going to become of me, because
Right.
I lose complete control when I surrender myself to the doctor in the hospital. I do not know what they're going to do with me, right? So it's brought about three major human fears, basic human fears. And so though those are the platform, and it didn't just happen and go away. We've been living with those fears now for almost 2 years. So it's something that is becoming chronic, and that is why the anxiety levels have gone up. And with the things that are byproducts of the COVID, like, financial loss of jobs, uncertainty in jobs, even if people who do have jobs, they feel they don't know when they'll be asked to leave if the company decides to cut costs. So to some extent, even people who are employed are living with fear. People are living at home, and I don't think that human beings and couples are so used to being so transparent at home, because the husband would typically, if working, then leave home in the morning and come back in the evening, and so would the wife if she's working. The children would have their own structure throughout the day. So life was external and internal, from the home point of view. Like there was life outside the house and inside the house, but now it's life only inside the house, which has led to complete loss of boundaries. That's scary for human beings. The loss, see, a lot of infidelity has also emerged during COVID times because of the phone and the laptop, the phone being accessible to each other. The laptop, when in use, you use it, you close it, and you go, and somebody peeks into it and sees things that are not meant for them to see. So
do you think you can be unfaithful using a device to your partner?
Comes from here. Device is only the means of exposure.
So you think faithfulness or unfaithfulness is it's here rather than physically being present with someone?
Absolutely.
So can you be physically present with someone and not be unfaithful to your partner? Is it possible?
I think faithful and unfaithful is again a very individual definition, people have for themselves. But for me, I feel that if if I'm thinking about something and I am working, I'm not being faithful to my work. So,
Right.
and if I am thinking about someone and being and living with someone, I don't think that's a measure of faith.
Okay. I'm sorry to digress. I don't know why I wanted to ask you that.
Interesting, isn't it?
That question. So yeah, so we were talking about anxiety. So before I sent you the Zoom invite, so I was waiting and I was excited, and so heart rate was going up a little bit, and there was that sense of excitement, and it's but the feeling is not, I wouldn't say similar, but it's kind of in the same area of little bit anxiety. Now, how do I know that is the difference between anxiety and excitement only that excitement is pleasant and anxiety is unpleasant? Or how does I'm trying to see how is it easier for someone to self-diagnose that what I'm feeling right now is normal, it's just excitement, there's a, I don't know, big cricket match happening or something. I hate cricket, but anyway, something like that. Something like that somebody's excited about, or I don't know, my India is going to win this guy's going to win that, or you have a big meeting coming up, or how do you really differentiate between the two?
That's a very useful question for listeners. There is healthy anxiety and there is unhealthy anxiety. The what you were describing before we began this is healthy anxiety, because it's a form of excitement. It's something that you are looking forward to. And the anxiety comes into play because of the fear. Like, I hope it goes well. I wonder, I mean, it could just be the question. I wonder how it'll go. I wonder what the other person is thinking about it. So it's not too intense because it's pleasure. It's a little bit of mystery. And you can, you look forward to resolving that mystery. So it doesn't leave any residue, because this anxiety that you felt before we began is not going to leave you exhausted or with residue.
Right.
But the anxiety that you feel when you are in fear, in the space of fear, that is exhausting, it's fatiguing, and it has more effects on the body than this kind of anxiety. So there is,
but you're still calling excitement, you're still putting excitement in the bucket of anxiety, though.
Yes.
And is that, and that's like a general consensus on that?
I don't know whether other psychologists would agree with me, but anxiety is a symptom of fear. So if I go literally by that, then the excitement also has elements of fear. And anxiety somehow, over the years has only become a negative word, but it's not always bad, or it's not always negative, because it also drives you to do your best. Right. Because you're afraid, it drives you to do your best. Because you're anxious or you're fearful of someone knocking you over on the road, you're careful. It leads you to make safe choices as well.
But that's negative reinforcement versus just choosing to wear the seatbelt because it's the law and it's the right thing to do. And
it could be negative, but then I think a little bit of the dose is needed, because human beings need balance. It's about balancing. It's not really, and when it's balanced, it's not in the negative or positive space. It's neutral. As long as there are thoughts of anything related to fear. For example, if I'm thinking, I don't know how this is going to go, I am so scared about this. Sometimes you know that you are scared. Sometimes you may not really know that you're fearful, but you would have a lot of questions indicating the direction the fear is taking. For example, I always say, that the emotions that you experience through your thoughts, they speak back to you through your body.
Right.
So you think, you feel, and then the body talks back to you. So for example, if someone comes and says, you are needed outside because there's a fight happening, or your friend's fallen, or someone's fallen, or whatever, my body would respond before my thought would, before I start feeling. So because my body has the memory of how I feel when I hear bad news.
Right.
Right.
So that's also the sympathetic nervous system, the fight or flight response kicks in and your heart starts pumping blood faster.
Correct.
And this is all from, thousands of years ago when we were cavemen trying to escape tiger, leopard, whatever. So
it's instinct. It's physical. See, anything to do with the physical realm is instinctive. Anything to do with the emotional realm is imaginative. Anything to do with the mental realm is intellectual. And anything to do with the spiritual realm is intuition.
Arey wow. So we need to, mull over this thought. So as you said that your body starts responding immediately, maybe even before your mind has given you time to process it, or the mind it's instant and so what you start feeling then, your body remembers those emotions or those feelings and so then what? So then I'm in this state.
Yeah, that's one way of figuring out anxiety.
Okay.
The body responding, the body responses.
Mm-hmm.
The other ways are, if supposing there's latent fear, that there is fear of something bad happening at any given point of time, and there is chronicness to that fear, then one may not be conscious about it till you start feeling maybe a sense of fatigue, breathlessness, palpitations, headaches, complete lethargy. And that would be a change in the way your body normally feels to you. So that's another way of identifying anxiety.
And what is a panic attack? Is it one symptom or one thing that anxiety leads to, or is that the panic attack itself is the anxiety?
So a panic attack is not something that will happen in isolation. A panic attack will happen when the anxiety has built up over a period of time before it culminates into a panic attack, but one may or may not be aware of that anxiety.
Okay.
So a panic attack is a heightened form of fear.
Right.
And it comes around with all the thoughts. So, on average, we have different people have like anywhere between 65,000 to 75,000 thoughts a day. In a panic attack, and for a panic attack to happen, one could have racing thoughts all at the same time. I'm not saying 75,000, but normally, and it's the same thoughts that are on repeat or autopilot mode, day after day after day after day. And I may be ignoring them, or I may be pushing them aside, or I may be distracting myself into some physical activity. And then at some point of time when I may have a trigger, or I may not even have a trigger, and it just explodes.
So one solution would be to manage those thoughts before they start accumulating. And how does one do that? Because as you're saying, maybe you distracted yourself with some physical activity. Is that not good enough to be able to distract yourself and do something else?
No, because it's a distraction. One has to go through through any feeling that one is feeling to come out of it.
So how does one do that? So let's say
that you have to become aware of it. मेरे को ना एक शेर याद आ रहा है इस बात.
हाँ, please.
It's I'll try and remember it. बहुत सोचता हूँ मैं, लेकिन क्या मैं ये सोचता हूँ कि मैं क्या सोचता हूँ? I think I have it right. Yeah.
बहुत सोचता हूँ मैं, लेकिन क्या मैं ये सोचता हूँ? क्या मैं ये सोचता हूँ कि मैं क्या सोचता हूँ? Yeah, that makes sense. That makes sense.
So it's, in other words, do I think about what I'm thinking?
But you would go crazy if you start thinking about what you're thinking in terms. I mean, I'm just obviously generalizing, but because isn't it bad enough that, maybe someone like myself who's an overthinker, or I think a lot, or I have a lot of thoughts. So if I start thinking about those thoughts, I mean, I understand what you're trying to say, and it's much easier said than done. Maybe focusing on the quality of the thoughts than the sheer magnitude of the thoughts that come into your mind, and how to hack that, or how to make that better, or how to make sure that they are useful thoughts versus thoughts that accumulate into negative thoughts or anxiety. And I remember that we had spoken a long time ago about this on some context about negative, positive, logistics, and waste
thoughts. Yeah.
So that's fine to know, but it's to bring it into practice is difficult. So is there something easy that you can recommend, especially for anxiety? Because this is something people are really suffering with, and even if they don't consult a psychologist or get any sort of help, is there anything that one can do which can help with managing anxiety, if not eliminating it, or is there a way to buffer it so that it never happens, or something like that, some sort of trick?
Yes. So barring what may have caused it, how it began, how the person learned to respond to the trigger through fear and by anxiety. I think the easiest way to manage it is have an alarm on your phone every 1 hour, maybe 2 hours, have a beep alarm on the phone. And every time the alarm beeps, check to think what you're thinking about.
Okay, that's interesting.
And that's
that when the alarm goes off, so you're going to just focus on your thoughts.
Yeah, because otherwise we won't remember to check our thoughts, because we get, humans tend to get engrossed in whatever they're doing. And also sometimes the work we are doing requires concentration.
And I guess this will also make sure that it's a random thought rather than a pre-planned thought that that now I have to think of something. So you can fool. We're so good at fooling ourselves. I think that's another issue. We're really, really good at fooling ourselves.
Rationalizing everything. उसने ऐसे बोला, गुस्सा तो आना ही था. So we justify and rationalize everything. But this is a good way to keep a check, because we talk about physical regulation. We speak about emotional regulation. We never speak about mental regulation. So I feel that if you learn to train your mind into thinking a certain way, and only about the things that you want to think about, and your thoughts are no longer on autopilot, that is what control is all about. It's not about, and thereby you also let go of the need to control the external to fix an internal issue.
But this you're talking about like someone who's a pro level meditator who can.
No, I'm just talking about beginning to become the captain of your ship of thoughts.
Yeah, take control. I understand what you're trying to say is take control of your thoughts
at the
and
beginner
take control.
level. Yeah.
So okay, this is a biohack. What you recommended is a biohack. I put an alarm every hour, or maybe it's not practical to do it every hour, but maybe in your since the time you wake up, 5-7 hours, put a repeating alarm.
It's practical to do it. It only takes 30 seconds to check your thoughts. It's not going to take you forever. Like, it's just 30 seconds. I'm sure we can invest that in ourselves.
Yeah, and I guess if nothing else, check your thought in the moment, and whatever you're thinking, convert it to something positive, at least for that particular alarm or for that particular moment. Yes. And eventually this should become habit and second nature. And so this is a very good biohack that you've given, and I think maybe I'll try it myself. I mean, I have lots of reminders on my phone which come up daily, from maybe affirmations to things that I want to check in my own behavior, which I'm not sure if they're helping, but they're there.
Yes. I'm a great believer of affirmations. And you remember when we had this talk about the 4 categories of thoughts?
Right. Yeah.
We also mentioned that the positive and the logistics are those that vibrate, that get you to vibrate at a higher level of energy.
Right.
So because every thought is radioactive energy, right? Um, so, you know, when I remember when I was in my earlier years of school, वो सुबह की प्रार्थना होती थी, तो they would say that जैसा सोचोगे तुम वैसा बन जाओगे was one of the lines of one of the prayers that we used to have in the morning. And of course, I understood that many years later. But so, I mean, I'm just saying that the thoughts are radioactive. We need to learn how to channel it. We need to learn how to energize them to energize ourselves. Because they don't just happen. We create thoughts. So we need to make sure that we create and co-create the right quality of thoughts, the right content of thoughts. And once we do that, there is a change you will feel in your body and your energy level, your interest level, your motivation levels.
And thoughts can be changed. That's the best part. Versus someone,
Absolutely.
it's much easier to at least force yourself to change a thought than say that, oh, I want to maybe run a marathon. It will take you. Anybody can run a marathon. They have to put in a lot of time and practice. But right now, what you're thinking, you can change it, or you can force yourself to change it, and it'll just take a second.
Yes.
And even if the other thought keeps coming back, you can keep changing it back and maybe have that internal battle with your demons or whatever you want to think about, think of it as. I wanted to talk a little bit about your thoughts on addiction, especially with technology, social media. Is that something that you are having to deal with a lot in your current practice? And obviously this has to be, common sense tells me this has to be going up. And of course, there are two things here. So one is addiction, generally speaking, and one is, of course, addiction specifically to technology and social media. And
yes, it has gone up because when people are at home and there are less opportunities to do creative activities as per their way of thinking. So technology is the easiest thing to reach out for. And if you keep doing it every day, and it gives you a happy feeling, then it just very quickly graduates to becoming an addiction. I don't have so many people coming to me with the addiction problem per se, but I do have other family members coming to me saying that this, my son or my husband or my brother has this and this is a change that has come about after the lockdown or during the lockdown. So I think it is the person who's hooked to whatever they are doing seems to have less of a problem than the other people around who are observing them and also who are dealing with their change of behavior because the structure goes for a toss. There is the lack of routine or the lack of timing, not sleeping on time, not waking up on time, not eating on time, affects other people at home.
And always having that some sort of a device, it gets irritating.
Yes. Yeah. Even if you go out for dinner or you're having dinner at home and everybody,
that's the worst. Yeah, that's the worst.
Yeah. And so long you are doing it, you have a justification for it. But if somebody
exactly.
else is doing it, it's not okay.
I think that is an easy thing, that everybody should have these rules and certain spaces in the house or certain times of the day that when you are doing certain activities together as a family, that there should be no phone around or no piece of technology around, not even television, even though television used to be the such a big deal, but now it's like the best thing is I'm okay with my child watching TV. Phone or iPad or laptop nahi hona chahiye, because the TV is at least an object that is stationary in a particular space. You can't move it around with you.
Yeah.
Versus these movable things. I'm not saying it's great, but it's just a little bit better than,
yes,
especially the phone and the iPad, and now with these kids, there's no school, they're having to do Zoom classes online. What do? Do you opt out and be the odd one out and get your and at least have the anxiety of your kid getting left behind in school or whatever class they have? Or do you opt in because this is the only way to do schooling at the moment? So actually, this is a lose-lose situation.
Yeah, but it's see, the fact that we have technology and the fact that we have all this equipment is great. I think it's the way we use it, and the amount of usage or the amount of dependence that we create. Again, we create upon it, because the equipment doesn't need us. We need the equipment.
Yeah, absolutely.
So if for example, if your child is attending classes in the morning, see, there is a time when school ends.
Yes.
The child does not need to use that laptop or iPad or phone, whatever they're attending on, and can also balance that with outdoor play, with other types of play, other types of hobbies. So it's more about structuring, planning a more balanced day for the children as well as yourself. So if I can do it for myself, it will be easier for me to encourage my child to do the same. But if I'm not able to do it for myself, then it'll be hard maybe to do it for the children. I know a lot of mothers at this point of time, they would say, I can't do it for myself, but I can do it for the child. Well, do it then. Structure it in a way where the burnout on the eyesight with the radiation, with all a lot of time spent around technology is antidoted or is substituted or is paralleled with nature.
But it's the easiest thing to do, and I noticed this even much before the pandemic ever happened. All over and all over the world, I've seen this. From the easiest thing was parents was just they hand their kid an iPad or a phone.
Yes.
And there are a lot of kids that don't even eat without the iPad or the phone. They have to be fed with that, and which is you're setting them up for failure, is my opinion, because they have a choice. At the moment you have a choice, obviously you're choosing the easiest thing to feed them, or you buy some peace of mind if you're stressed out and you've had a busy day and you just need to entertain your child and just want some peace and quiet. The easiest thing to do is hand them an iPad or some sort of technology to entertain them. And sometimes I understand that sometimes you really need that, but I've seen this all over the world, and at restaurants, family, and the smallest kids or the kids have some sort of a device and they're entertained and quiet and so well behaved, but that well-behaved kid is going to pay a price in the future, is my opinion, with some sort of addiction to this device and this technology. And of course there's no doubt about the number of mental health issues that younger and younger kids are having, and I totally blame in a big way the social media devices, Instagram, all these things that are going on these social media platforms to exasperate, if not cause them, but at least to add to the problems that they're already having.
Yes, and subconsciously you're also teaching the child to pick the easy way out, because that's what you're role modeling for the child, right? If you want to eat in peace, here's the iPad or here's the phone, instead of engaging with the child.
Even if you're regulating them, if it's about learn by example, you're not giving it to them, but you are on it all the time. So the child is seeing you, and then there's this thing of, why are you allowed to do it? So if you're allowed to do it, I should be allowed to do it, or they will eventually do it, because that's the behavior they're noticing in their parents.
Yes, and a lot of habits come out of role modeling, because for a child, the parents are the role models.
100%, right. Especially for small kids.
Yes.
They're going to talk the way their parents do. They're going to ape their parents, basically.
Yeah.
Okay, so I know we're short on time, so I will wrap this up. I had lots of other questions for you. I think maybe we can just talk about this is a good time to also differentiate between, and I know I've answered this question several times on the podcast, but between a psychologist and a psychiatrist. And then I just wanted your opinion on pharmaceuticals, in the use of pharmaceuticals in dealing with mental health issues. And
yes, and while I'm talking about the psychological inputs, differentiating between a psychologist and a psychiatrist, I'll build in the theories that I mentioned at the beginning of the conversation, that these are the tools that psychologists can use. See, a psychiatrist, it's basically the fields of study are different, because a psychiatrist learns like the anatomy and the physiology of the brain and its working, the various parts, the chemicals released, the hormones connected to it, and any kind of irregulation in that causes what are the ailments or what are the problems that it can have. And that is why the psychiatric studies, a psychiatrist, studies doctor of medicine and approaches healing with medication, because that's what the training entails.
right.
And psychiatrists usually are found in medical clinical settings, unless they have a practice of their own. But even when they have a practice of their own, it is clinical. Whereas a psychologist works largely under 5 types of therapy. One is the psychodynamic approach that I had mentioned, which was the Freud who founded it. And it looks at the connection between the unconscious mind behavior. And there are many psychodynamic sub-theories which have evolved over the past number of years that we use and which go into healing and eventually cure. There is the behavioral therapies. Behavioral therapies is based upon past experiences. Behavioral therapies believe that the behavior is based upon past experiences, social and family conditioning, and facilitates to change behavioral responses. So the systematic desensitization, aversion therapy, and flooding are examples of behavioral approach. Then there is the cognitive behavior therapy, which is similar to behavioral therapy, but it also addresses unhelpful thought patterns or problematic thoughts, which propel the individual to behave in ways that are odd or unusual. And the idea behind CBT is that certain feelings or beliefs you have about yourself or situations in your life can lead to distress, and the distress is what contributes to the odd behavior. Okay. And it could also develop as a complication of other mental health issues. Typically, rational emotive therapy and dialectical behavior therapy are approaches under the CBT umbrella.
Okay.
The fourth one is the humanistic therapy, which is an approach that looks at how your worldview affects the choices you make, especially choices that cause distress and are self-sabotaging. It's based on the belief that you are the best person to understand your experiences and needs. And the humanist therapists work to help you better understand that you're experiencing, whatever you're experiencing, the way you're interpreting your experience, and they offer guidance and support without interpreting your feelings for you. They get you to interpret that. And so existential therapy, person-centered therapy, like I mentioned earlier, was developed by Carl Rogers. The Gestalt are all approaches under the humanistic therapy umbrella. And the last is the solution-based brief therapy. This is more cognitive in its approach, and this particular therapy could take one session or maybe a few sessions, and it only looks at the social level issues. For example, It revolves around only 3 questions. What is it? What is the problem? What is it that you're experiencing? What is it that you want to experience, and how do you get there? And the work is around that area. This is largely the difference between the two.
Okay.
The
I know we're
psychologist
really
works with-
short on time, so maybe you can comment on the pharmaceuticals bit.
pharmaceuticals.
Yeah, because that's a touchy, controversial. We all have our opinions about this.
Yeah.
So we can comment, and then I will let you go, and we have to do a part 2 because there's a lot more stuff that I want to discuss.
Certainly. Thank you for having me, Yameer. This has been so good.
I'm thoroughly enjoying it. I don't know how much I'm nerding, geeking out on this stuff because I really enjoy this space and I enjoy learning more about things here. And it's great. It's a great opportunity to pick a brain like yours about something like this.
We thank you, Parul, for introducing us.
Yes, absolutely.
Yes,
absolutely.
And I love your book. I recommend it.
Oh, thank you. Yes, thank you so much. Thank you.
So around pharmaceuticals, I feel where essential, they do help, but they need to be under prescription, strictly under prescription. Because I don't think
but prescriptions, come on, listen, we're in India now. Now, how difficult is it to get a prescription for anything? You tell me.
But mental health के लिए जो drugs use होते हैं, it is not easy to get a prescription for them.
So, by the way, now you tell me, do I need a prescription? You tell me the drug. I would love to do this on the phone. I want to call my chemist on speaker without revealing who the chemist is. It could be any chemist.
Yeah.
And tell him कि भैया ये दवाई चाहिए थी है. हाँ sir, अभी भेज देता हूँ. And 10 minutes it will come here in 10 minutes. So I understand that this is a prescription class A, prescription restricted, all that stuff I understand. But I also feel that prescriptions are being unnecessarily dished out. And of course, I don't want to make that taboo because I understand that there are enough people who need that intervention of a pill. They are at that stage. But I also know of several people who did not need it and were given it, including some kids that I know, and with reasonably devastating or close to devastating consequences, potential consequences.
Yes, it touches a chord in me because I do know of some very long-term disastrous effects it's had on people. And these are, two people that I'm referring to did go to a psychiatrist and were prescribed the medication. And I think the body or the mind did not need it. And it had very bad consequences. I'm not a fan of medicine. I think that, like I said, if we have the ability to create a disease, and by the way, the dis-ease, the disease comes from the word, the dis-ease in the body.
Right.
And the dis-ease is born out of the cells when they don't feel that they're in a good environment in the body. That's when the dis-ease in the body sets in. So a lot of it can be controlled by all the other alternative methods that Yameer, you practice, and I talk about, and a combination of both of them, or even more, like think that there may be things that I and you don't know about natural cure. But absolutely. I just believe that I think that people need to be patient if they have a problem and try and cure it the natural way. But of course, if there is a fracture, or if there, उस समय medical intervention zaruri hai, medicine zaruri hai. But I also feel that they can regulate that. One can opt to take the minimal medicines, the correct ones, and they do not need to keep on taking it because it's just so comfortable to pop the pill and feel better.
So use it as a last resort, which is what I also always say.
Yeah, use it as a last resort. And even when you use it as a last resort, use it as a supplement to healing and cure.
But another issue is especially with pharmaceuticals and the mental health ones which are used, it's so difficult to leave them. because they create havoc in the mind and body, and it's not easy to leave them. They're highly addictive. And in some cases, you'll be much worse off after you started them, but then you still can't leave them. I mean, there's so much. And this is not conjecture or opinion. This is documented stuff.
Absolutely. Haven't you? I remember one of the times we spoke about Dr. Bruce Lipton, who's come up with the epigenetics.
Yes. Yeah.
Right?
Yeah.
Epigenetics doesn't even believe in medication. He says that all pills have a placebo effect. It's because you think you're going to get better, you get better. It's not because of the chemical in the pill or in whatever
Absolutely.
medication. Yeah. So I believe in that.
So Bruce Lipton is, of course, amazing. Biology of Belief. I wrote about him, in my book too. I assume you have no time left because you have an appointment, and even though it's a Sunday, you are choosing to not give your mind a break from other people's minds, which is highly noble of you. So thank you for giving us so much time. And I definitely want to do a part 2. And I just want to mention that, of course, none of this is medical advice. And as you know, people need to do their own research before they act on anything that we've said. It's our opinion. And how does one get in touch with you now? I know you don't have any slots left for people who want to reach out to, or maybe get some help, get some therapy, or do a session with you. So how does one reach out and maybe try and get you some time? Can they email you, or can they? How do they reach out to you?
Phone would be the best way to reach.
I don't think I want to share your mobile number, so I think it's better that I share your email. Or
all right, you can share my email. That's fine.
I'll share your email, and so and I'll put that up so that people can reach out to you if they want to do a session, and they can.
And I always have slots. I will create
great.
slots.
Okay, excellent.
Wants to talk, I'm here.
Okay, excellent. Good to know. So please reach out to Dr. Vimal Kumar Sawhney. The first time I think I'm saying your full name. So please reach out, and we're very grateful for your time. And we have to do a part 2. So thank you very, very much. I have thoroughly enjoyed myself.
Me too. That makes 2 of us, and I'm on board for part 2.
Absolutely. We'll do it soon.
Anything
I'm going to schedule it. Thank you so much. Thank you so much.
Such a pleasure. Thank you.
I hope you enjoyed that. Thank you for staying tuned for so long in the podcast. That was 2 hours. There's a lot more that I need to discuss with Dr. Sawhney. So we're going to do a part 2. And if you have any questions in the meantime, put them in the comment section below on YouTube.
Voices in My Head is created and hosted by Yameer Adhar. This podcast is for information purposes only. Statements and views expressed on this podcast are not medical advice. We disclaim responsibility for any adverse effects that may arise from any information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guests' qualifications or credibility. If you think you have a medical problem, consult a licensed physician.